share with all of you what works in metro, not necessarily work in rural. What works in rural can certainly work in metro. The computer and the connector from iCure has to connect to the cloud now. So let us welcome our speaker. And originally, Mr. Niranjan Kumar is supposed to engage this session of sharing his experience of how Sir Gangaram has gone into cloud. As I already mentioned, that due to some emergency meeting, he could not join. On his behalf, yes, I request her to introduce also. I'm sorry for that. And let us hear from horse's mouth, please.
Good afternoon, everyone. My name is Dr. Ruby. I'm Deputy Medical Superintendent at Sir Gangaram Hospital. Mr. Niranjan, who is our head IT, couldn't join you just because there was a meeting at the last minute. I'm so sorry for that. So he was supposed to speak on IT-enabled healthcare. So I'll try to tell you what exactly he wanted to say, but I'm sorry I won't be able to answer all your questions. Patient management. There are 10 important issues which we look for patient management in a hospital. They are like patient waiting time, test results follow-up, missed appointments, medication management, documentation, access to information, communication, medical record retention, patient satisfaction, and the last but the least, training and retention. Patient waiting. This is a normal scenario of any hospital, including Gangaram Hospital. This we have taken picture from the hospital at Vellore. Patients are waiting. We have got less space in our hospital, and they're waiting for their appointments, for their medical checkup, for their test results. They've got long queues, which for test follow-up, for billing purposes. If you miss the appointment or you need OPD registration, IPD registration, you have to stand in queue, and we require space and everything for that. We need space to put our medical records in, both IPD, OPD, casualty records. The medication management in the IPD and the OPD services. We need skilled staff to cater our population. We have less number of doctors and more patients. Important is communication also. How do we tell our patient about their diagnosis, about what medication to be taken, and the route. Patient has got right to health information, and today's patient who are poor, there's hardly time to see patient. So how will they know what exactly is going on and what is their history and everything? And last, the patient satisfaction, which is the most important thing. Patient says, how do I take part in my treatment process? What are the key challenges we are facing at the moment? They are the unique identification number is not in the place. A lot of changes happening demographically at the moment, changing of place and state and everything. The doctors are less, so we want to see more patient in small time. There are waiting room issues. Like I look after the private OPD also of Gangaram Hospital. Doctors only have 2 to 4 hours slot, and there are 60 to 100 patients who want to see in the private OPD itself. So space is a constraint. Definitely, we cannot have more than a number of person in the front office. So the quality of the work decreases because there's more pressure. Insufficient scheduling, appointment system, everything, and a lot more to go. What does a healthcare expects today? Today we are curing the patient. Tomorrow we should care for the patient. Today we go to the hospital when we are sick, but future we should get ourselves examined yearly wise, so that thing never turns up. Today time for healthcare is symptomatic and curative. Tomorrow we should be preventive, and the lifespan should increase. Today we go to hospital for all tests. In future we want all the facility to be provided at home. Like a doctor should visit at home, you should have all the samples taken at home, decentralized for the more comfort of the patient. Just all the records and everything is kept. This is a smart EMR system, electronic medical record system. We should have everything in the system itself. What is the scenario of today? Patient has a piece of paper as a medical record. When he comes to the OPD, a doctor has written few tests, scribbled, and he may not be carrying all the reports. Providers are making treatment decisions based on the incomplete information. What if the patient, what if the patient is saying to doctor in that small span of time? Doctor has got no access to the history of the patient. Emergency care treatment decisions are based on only the small information provided by the patient. Whatever the information is being collected or is stored, whatever the information is being collected are stored in individual provider practice, make difficult for both patient and the provider to access. Consumers have limited access and control over this information. This requires that provider use electronic medical records for the system. What is the existing approach to the information sharing? A portal system, which hospitals have it at the moment. This type of solution involves the creation of a user interference that can work with the information from the different sources and manipulate the way it presented. Like currently in Gangaram Hospital, we are trying to we'll try to bring in the OPD system. Whenever the doctor says something to the patient, we'll record at the same time simultaneously, and we'll generate a unique registration number. So the next time when the patient comes, he just tells his unique identification number and all the history, all the medicines which are given, which were prescribed at the last time, whatever the tests were done, which is easily available in the system. But disadvantages are that that like I told you, in 1 hour time, if I have to see 30 to 60 patients, it will be difficult for a doctor or even a medical transcriptist sitting next to him to add all the information. Existing approach, one more thing is single vendor involves replacing the traditional view of the existing PAC system and clinical support system used by the practices and communities with a product line from a single vendor entered upon their PAC solution. The rationale behind this approach is that a single vendor can provide connectivity and full synchronization between different parties as a uniform workshop for all the participants. They've got their few advantages and disadvantages. Disadvantages like it's costly, it's lengthy, requires major change, management involvement, and successful implementation often may not be possible. Personal health records. The personal health records is a tool that can allow people to access and coordinate their lifelong health information, make appropriate part of it available to all those who need it. The patient as himself, this approach relies on the patient to maintain and deliver medical information. This is done in one or two ways. Either patient carries information on a portal media device, such as smart card on a USB device. It will have advantages and disadvantages both to it. Advantages like clear ownership of the information, simple access to information. Disadvantage like its privacy is not maintained. Who might be else be managing that thing? They can see also. So what is new? The best thing for the government or for us is to create a single window where patient may go to any of the hospital. All the information should go in that electronic media, so that this information will be available to all the clinicians. Patient has gone to AIMS or Safdarjung or Gangaram Hospital. Any doctor can see the information and react accordingly. Patient can also access and contribute, like for example, he's doing a BP monitoring or sugar at home. He can also put their record in that system itself. Information will be gathered as a part of process of care. There is capability for electronic communication between the individual and the clinicians. Standardized care pathway and standardized information are achieved. Self-care is strongly supported by the system and professionals. There is a strong reliance on the health education. The system capability does not negate the need for the personal contact with the people. And business intelligence, clinical audit and reporting features inform public health and clinical policies. So this health information system, which we should have, it can be like when you are monitoring at home yourself, you can put your data in that, all the clinical records, all the communication and decision support. It works with all these four components. Whatever the pharmacies, whatever you are buying from the pharmacy, from the physician, your insurance, your doctor, all the information goes in that system. It's a single database model. So patient will have his right to know, to access, and it will be both beneficial for the patient as well as for the doctor. Definitely the cost is involved in the device and making the system, in in collection of the records and keeping the records. Mr. Niranjan had and should be available to the remote areas also. Mr. Niranjan had opened up a kiosk system in the one of the remote areas, which was inaugurated by Mr. Abdul Kalam, and the patient, with the help of a smart card, could just access all his records. A small kiosk like a vending machine. Just put the card in and you can see all the information. Thank you. When dealing with the people, remember you are not dealing with the creature of logic, but creature of emotions. Thank you, sir. Any questions? I'll try, I'm not sure. Thank you.
I take this opportunity to thank all the delegates and also all the three speakers, and particularly Dr. Ji, and who made it. We are sorry for all the inconvenience caused due to any reason. And maybe quickly we will take a break, tea break, and then we will adjourn for the most wanted panel discussion. Already panel members are also here. That all the panel members' attendance is guaranteed. Right. Thank you. Take a quick break and we'll